this is commonly asked question. The concept also is very important. So what is the diagnosis based on the image? It's from pediatric surgery. Option A, how many? Option B, how many?
Option A.
Option B.
Option B.
It's gastroenteritis because
Sir, option B.
because the birth defect is next to the next to the umbilicus. It's not at the umbilicus.
So most of them will mark option B, and some people there is confusion between omphalocele and gastroschisis. So I'll discuss what is it. But you should never mark umbilical hernia or spigelian hernia. It is wrong. Why? Umbilical hernia or spigelian hernia, they'll just look like this. They are swelling covered with skin. See here. Okay, they'll just look like this. Just swelling from the skin. Hernia. What is hernia basically?
Protrusion.
Protrusion on weak area.
Yeah, hernia is a weakness. Okay, it's a weakness. So the contents will come through it, and there will be an overlying skin over it. So that is it. So here you see epigastric, paraumbilical, umbilical, lumbar, spigelian, lumbar. This is lumbar hernia. This is spigelian hernia. Femoral, lingual, you know. These are the various type of hernias. Okay, epigastric, paraumbilical, umbilical, lumbar, spigelian, femoral, and inguinal. Okay. So hernia will look like this. Never forget. Okay. You should never mark in such type of images. Never mark hernia first of all. So other sites of hernia: umbilical, paraumbilical, lumbar, spigelian, femoral, and inguinal. These are the various sites. If you see this site and this protrusion, mark it as that hernia. So these are the real images of. Sorry.
If it is with an incision, it could be incisional hernia also.
Yeah. Obviously if there is incision, or in the question they will mention to you, a patient underwent cesarean section at the age of 25. Now she came with swelling over the incision site, which is reducible. It is obviously incisional hernia. Okay. Yeah.
Okay.
So these images see omphalocele and gastroschisis. Okay. Once you can see the images clearly. So what are the differences? Now we'll see. Here in omphalocele, first of all, there is a sac here. There are contents inside. There is sac, there are contents, and on top of it, the umbilical cord will be there. So there is a sac, there are contents, on top of it, the umbilical cord is there. That is omphalocele. Whereas gastroschisis, there is no sac, first of all. There are only contents, and the location of umbilicus is to the right of umbilicus. The location of this contents is to the right of the umbilicus. Omphalocele, it is on the umbilicus. Sac, no. There is sac S in umbilicus, in omphalocele. Contents, only the bowel is the content in gastroschisis. The name itself is telling gastroschisis. Gastro, only the bowel, small intestine and colon. Whereas omphalocele, liver may be there, intestine may be there, gonads may be there. Okay? And read this point, how is it and all. And associated anomalies, only mechanical complications like intestinal atresia is there, mechanical. Here, chromosomal anomalies are there, cardiac anomalies are there, pulmonary anomalies are there. Now see here. See, where is the umbilicus?
Towards the right.
Yeah, right of umbilicus, the sac is there. And there is no intestine, there is no sac at all. Okay, these are the findings. And this child is not having any chromosomal anomalies, pulmonary complications, cardiac complications. So which prognosis is good? Omphalocele prognosis or gastroschisis? Whose prognosis is good? Gastroschisis prognosis is good. Why?
Because it does not have chromosomal anomalies.
Yeah, it does not have any chromosomal anomalies. Clear this point. This question is very, very important. Almost asked every alternate year. Yes, no?
Yes, sir.
You take 2 minutes for this slide also, just recollect what I told you. Okay. See the outcome here, last slide, outcome. It is good. It is dependent upon the size and associated anomalies. It's bad. Okay, we have only half an hour before lunch, so we'll just have some images like surgical devices. This is very important, and then we'll have thyroid in the afternoon session. Is it okay?
Okay, sir.
Okay,
It is
sir.
now 12:40, 12:50 it is. At 1:30 we'll have lunch, and afternoon we'll have thyroid section. So, what is happening here? What is this?
Option C.
Surgical approach described here. This is a female patient. See this? This is a female patient, and the surgeon has introduced scope through the vagina into the peritoneum. Into the vagina, into the peritoneum.
But
Vagina assisted.
Yeah, VATS.
No, it is okay. You first time you are seeing this. Okay, just remember it is known as NOTES, natural orifice transluminal endoscopic surgery. We use the natural orifices only. What are the various natural orifices we use? One is vagina, oral cavity, rectum. Only three. In females, we can use vagina. In males, only oral cavity and rectum. These are the natural orifices. Okay, natural orifice transluminal endoscopic surgery. Okay, so this is the option. Once you see this image, next time you should never forget. So, what is the advantage of it and what is the disadvantage of it?
advantages, there is no external orifice made.
No,
External other orifice made from outside. No invasion from
yeah.
outside.
So no, the invasion is there. You are going inside, but there is no external scar over the body. Okay, there is no scar, right? It is
Yes,
very,
sir.
very cosmetic. There is no scar in the body. You use natural orifice. Okay, that is the advantage. So, what is the disadvantage? Think and tell. There is nothing like wrong answer or something like that. Just think.
Infection.
Function of that organ will be hampered. Okay, and infection. See, oral cavity and anum and rectum both have, in males especially, they have lot of microorganisms. So once you put a scope through this, what happens? You are introducing infection, right?
Yes, sir.
Yes, no.
Yes,
Yes,
sir.
sir.
Yeah. So these are the side effects. These are the advantage and disadvantage. Okay. Advantage is you have no. It is a very cosmetic surgery. Disadvantage is the chance of infection and local that organ will become. You are hampering that local organ's function. That is about that. Okay. And we'll just discuss what are the other things also. So what is this less? What is less? Anybody? What is VATS? What is SILS? You know now, not you know.
Laparoscopy.
SILS is single incision lab surgery. Single incision lab surgery. Single incision lab surgery. SILS. Only one incision will be there. Only one incision and one port. SILS. Okay. And VATS. What is VATS? V is
Vaginal.
ATS.
Video assisted.
Video
Video
assisted
assisted. Okay. S is
thoracoscopy surgery.
S is surgery. C is thoracoscopic. Excellent. So, video assisted thoracoscopic surgery. Yeah, video assisted thoracoscopic surgery. Yeah. Video assisted thoracoscopic surgery. And LESS, less is laparoendoscopic.
Laparoendoscopic.
Single site.
Single incision surgery.
Surgery.
Okay. There is a single incision only. And this, no need to go about this, but what is this instrument?
It's a varus needle.
It is a varus needle. Very good. Varus needle. Okay. What is this system?
The robotic surgery.
Yeah, it is the robotic surgery. So in robotic surgery, what is there is the surgeon will be sitting away from the patient. Okay, the robot will be docked over the patient. The robot is docked. There is a process called docking. There are multiple ports, and we'll place the robot inside, and the surgeon will operate from there. Okay, so he will move his arms. The robotic arms will move inside the abdomen. Okay, so there is precision, increased precision. Okay, in the you have seen this before. This is this one robotic surgery,
Yes,
Yes.
this image
Yes, sir.
Yes.
you have seen. Okay,
even
So-
the instrument we have seen.
sorry,
Even the instrument we have seen.
instrument you have seen. Very good. So then just see here, advantages of robotic surgery over lap surgery are all accept. So can you just see the options and tell me what is that answer?
So there is increased degree of freedom of movement for sure.
It is there for sure. Yes, sure it is there, right?
Yeah.
Yes.
3D vision as well, because yes, you see watch on the screen, so you get to watch it all. So that's there.
Yeah.
Surgeon's ergonomics.
Ergonomics is nothing but it is comfort. Surgeon
Okay.
comfort. Ergonomics
Yeah.
is
So
comfort.
Yeah,
that's there. So that's
Tactile
there as
feedback
well.
isn't there.
Yeah,
Tactile
tactile
feedback is not.
Tactile feedback is not there both in robotic and both in lab. Okay. What is tactile feedback? Tactile is sensation. If you
Sensations.
do an open surgery, open surgery only, we'll have the tactile sensation. Otherwise, there is no tactile sensation at all. Clear?
Okay, sir.
Yeah. And see, this you have seen laparoscopic instruments. They'll be like long rods. Okay, laparoscopic instruments. So there is only two ways of freedom. You can move like this, or you can move like this. One way, second way. But in robotic arms, you can move just like your wrist. There are 7 degrees of freedom. Okay, you can move as you want. So there are 7 degrees of freedom. The arm will move like that in robot. Whereas in lap, suppose this is simple. This pen is a lap instrument. It can move only this way and this way. You can't move other ways. But wrist can move anyway. You can move in 7 ways. Okay, 7 degrees of freedom are there. You can rotate also. Okay, so this is the basic advantage of a robot. It has 7 degrees of freedom, whereas laparoscopy has only 2 ways of freedom. Remember that. And tactile feedback is not there in robot. Is it there in lab? Yes, no?
No, sir.
It is not there in lab also. Okay. What is this? Basically, what is this? Tell me, and then we can discuss. It is a
Pressure dressing.
negative pressure wound therapy. We call it as negative pressure wound therapy. So what is negative pressure is, see, in some wounds are clean, some wounds are dirty. There will be a lot of exudate coming from outside, from inside. Exudate will be coming, that is lot of pus will be coming. So we'll connect this negative pressure dressing so that it will be connected to the negative pressure. Whatever is there, it will be sucked out. Okay. So the pressure here is 125 millimeter of mercury. 125 millimeter of mercury. Negative mercury. That is, it will be sucking with that much negative pressure. Okay. So just remember our BP is 120. It is also 120. This is very important question asked 2 times. Last year, before last year, once it was asked. Okay. So the dressing is known as, what is this dressing?
Negative pressure wound therapy.
Yeah, or you can Just remember negative pressure NPWT and the pressure is 125 minus
So
120.
can this be used for ICD tube also?
ICD,
Yes, sir. ICD
yeah,
you can.
intermittently they will use it. Intermittently to make the lung expand, they will connect it to the negative pressure intermittently, not completely.
Okay.
Okay. Sometimes the lungs will be collapsed, right? So in order to make that lung open, we put a tube in the pleural cavity and we give negative pressure intermittently so that the lung will expand gradually.
Okay.
So these instruments, what is this? What is this retractor? What is this basically?
It is a
It's a
retractor.
Retractor, but what retractor? It has a name specifically. Retractor. It is known as Langenbach retractor. Langenbach. Okay, just remember these images they are asking nowadays as Langenbach retractor. Which book you follow for surgery? Textbook. Manipal?
Yes, sir.
Yeah. In that also, I think in the last pages they have given some instruments.
Yes,
In
sir.
Manipal also. Yes?
Yes, sir.
Yeah. Just before going to the exam, just read that because images, definitely one image is coming from the last 4-5 years. Okay. They're just focusing one image. Either a needle, either a suture. One thing is for sure. So this is a Langenbach retractor. Okay. So what is this? This is also a retractor. This is basically to retract the tissues while operating. When we operate incision, just retract. So what is this retractor? Anyone?
Morris?
Morris.
Yeah, Morris.
Heard before? Not heard?
Yes, we have used
Heard,
this
sir.
once Doyens as well. I have used it.
Yeah, you have used it. Okay. So this is the Langenbach retractor. This is the Morris retractor. You have to. This is what is this? This is also a retractor.
It's a Devers.
Yeah, it's a Dever retractor. Dever. Okay. Just it's a Dever retractor. It is used to retract the liver and all, which will be if you put Morris on the liver will lacerate, bleed. So you'll put this Dever retractor over the Dever retractor. It is known as. So 3 retractors I have shown you. Remember, this is the Langenbach, Morris, Dever, and this one is used in which surgery? This is also a retractor.
C-section.
Mouth.
This is used in thyroid surgeries. Thyroid surgeries. Okay. This is known as Joll's thyroid retractor. Joll's. And what is the advantage of this? Anyone? It is a self-retaining. Yeah, it is a self-retaining retractor. What is the meaning of self-retaining retractor? Self-retaining means?
Once you fix it, it does not just come out like
Yeah.
that.
See, the other retractors are there. Na? You have some surgeon will operate. The assistant should hold the other retractors. Okay. So you need manpower for that. So you need somebody to hold the retractor for you. Okay. Then only you can see what is going on inside. Either a Langenbach, either a Morris, or either a Dever retractor. But this retractor, once you open, you just put the retractor there and fix it off. You have screws here. See, you have these screws here. With the screws, you can fix on the skin so that it will not move. So it is a Joll's self-retaining thyroid retractor. Yes.
Yes, sir.
Please. Following yes, no.
Yes, sir.
Yes, sir.
Yeah. See, the topics you'll read definitely. Breast, thyroid, the trauma, everything you'll read. But these type of miscellaneous topics, you will not read most of the time. You will keep it to the last. So just focus here. You will understand. Just remember, Langenbach. What is Langenbach? A small retractor is Langenbach. Big one is Morris. This S-shaped retractor is Dever. This self-retaining Joll's. Only 4 retractors we have. And what is this?
Alice forceps.
Yeah, this is a forceps. This is Alice forceps. Alice forceps. So see here, the arrangement is like this teeth. Okay, the arrangement is like it used to hold structures like rectus teeth. It is good to hold tough structures. Okay, this is an Alice forceps. Yes.
Yes,
What
sir.
is this then?
Babcock.
Yeah, this is a Babcock forceps. So see this, the edge will be like this. It has a small, the edge will be like this. It has no serrations. So you can hold some soft structures. Which is the structures which we can hold with this? Two structures, tell me, one in male and one in female.
Over fallopian tubes, for example.
Fallopian tube, very good.
Yes. And bowels as well.
Bowels also we can hold, but specifically for appendix.
Okay.
In appendicectomy, we will just open it and just hold it with this. Okay, for an appendicectomy. Okay. This is not clear. Okay. What are these?
Scalpel blades.
Scalpel
These
blades.
are various surgical blades. Okay, surgical blades. Okay. So
Size 11.
1, 2. So what is 1 used for? What is 2 used for? Just these two are important. 11 and 22.
11 is, I think, arteriotomy, and 222 is for abdominal incision.
Yeah, 22 you are correct. 22 for abdominal. See, this has a belly. Okay, this has a belly. We call it as belly. So this is used for laparotomies. 22 used for laparotomy. Okay, but see here, this is a sharp end. We have to stab it for stab incisions. Where we go stab incisions? Stab incisions. Where we go stab incisions?
For cystectomy as well, we use those.
For cystectomy. Okay, better. Like,
Circumcision.
there is a cavity with pus. What you need to do?
Incision and
Abscess
drainage,
drain.
basically.
Yeah,
Incision.
for IND. So for IND, what you do? You give a stab incision for IND. Okay. Yes. No. So 11
Yes,
for
sir.
IND, stab wound. 22 for laparotomy. 15 for arteriotomy. This one, 15 you can use for arteriotomy. Even 11 you can use, but 15 is precise. 15 you can use for arteriotomy. Okay. And what is this?
Diatherm.
Diatherms and monotherms.
Yeah. Yesterday we were discussing in QR. So this
Monopolar,
is a bipolar
bipolar.
diatherm. It's a electrosurgical generator. We call it as electrosurgical generator. Okay. It has a bipolar, 2 arms. Bipolar, 2 arms. It has a monopolar, single arm. This is a patient electrode, patient pad. We call it as patient pad. So actually, what is this electrosurgical generator doing in your OT? This is an OT instrument. Okay. So what is this doing? Why do we require this?
Diathermy.
Cauterization
Like
and cutting of tissues.
Yeah. So what does this do basically? They convert AC into
DC.
DC.
DC. Yeah. See, whatever we have from our plugs, our systems, whatever we get is alternating current. Okay, our laptops and we charge with the plugs. So this current we can't use directly on the patient. So this alternating current is converted to direct current with the help of this electrosurgical generator. So then this current will be, if this current is generated between 2 arms, it is a bipolar diathermy. If it comes to a single arm, then it is used for monopolar diathermy. Okay. So that this is not getting any shock. Otherwise, if direct AC if you give to the patient, it will have a shock on the patient. Yes, no?
Sir. Yes, sir.
Yes, it will, sir.
So monopolar, we use it for cutting, coagulation, and bipolar we use for cauterization. Okay, cut, coagulation, and cautery. Knots. Now we have covered blades, we have covered some instruments. Just recollect how will a Babcock look like? Babcock. How will a Alice look like? You will get confused with Alice and Babcock. So
Alice
where is
has
Alice
that
used?
sawtooth appearance.
Yeah, where is Babcock's used?
Appendix.
Fallopian tubes.
Fallopian tube and appendix. Very good. So there are 2 types of knots. Putting the knot. Okay. One is a granny knot. This is a granny knot, which we learned from a granny knot. And the one is a square knot. All surgery knots should be square knots. Okay. There is no granny knots because granny knots are not secure knots. Such square knots are secure knots. What do you mean by secure and insecure?
It's
Secure
intact.
doesn't easily
Secure
come
is
out.
intact.
Intact. Yeah. Granny knots are slip knots. They slip. Okay. See here. Look at the image carefully. You'll never forget. Look at the image. See here.
Both sides of the thread will be
Yeah.
enclosed in the other.
Here, red is above, blue is below. Here, see, blue is above, red is below. Okay, that there is no synchrony. See here, red is below here, red is below here, blue is above, blue is above. Okay, so there is perfect synchrony. Okay, so once if that happens only, the knot we call it as knot is square knot. All surgical knots should be square knots. Then only they are secure. There should not be any granny knot. Okay. Yes, no?
Yes, sir.
Yes, sir.
Yeah. What do you call it? Granny knots in your language, Tamil? What do you call granny knots? They're slip knots.
I don't know.
Slipknot. That's Tamil?
Yeah. No. I'm just asking. There is a colloquial name, right? Anyone from Andhra? I am basically from Andhra, so I have a name for that. Anybody from Andhra? Or anyone knows Telugu?
Yeah, sir, a bit.
Yeah, it is.
Yeah,
we call
sure.
it Jarumudi. We call it as.
The
Jarumudi.
coconut fiber. I mean, that's right.
No.
No.
In our homes and all, we use this, right? You will not never forget. That's why I'm telling you. We call it as Jarumudi. It's a slipper knot. Jaru means slip. Okay, so it's a slip knot. In the same way, because in the last session when I was discussing, I told this. People came up with that. We regularly call it with some name like that. They told. That's why I'm asking you. Okay. So this is a square knot. The other one is square knot. Never forget. Both blue arms will be above and red arms will be below. So see this. This is a square knot. See here. The white is above. Again, the white is above. The black is below, and the black is below. Okay. So this is a square knot. Square knot, or other name of our square knot is reef knot. Reef knot. See, the surgeon's knot is always a square knot only. See here, one, and it has multiple. How many times also is okay, but it is always above. 1, 2. That is a surgeon's knot. Okay. Clear with this? Yes, no?
Yes, sir.
Yes, sir.
All yes, no?
Yes, sir.
Yes,
Yes.
sir.
Yeah. Now we'll discuss about something about the sutures. I think you all sutured some wounds in your house surgery. Yes.
Yes, sir.
So see here,
Yes, sir.
simple suture. This is a simple suture. This is a wound. Suppose this is a wound. You take a bite here. You take a bite here and take a knot here. That is a simple suture. Simple and interrupted. You take it like this. Interrupted suture. That is one. Next, what is mattress suture? You take one long, short and short. That is mattress suture. The mattress may be a vertical mattress or a horizontal mattress. Okay, vertical mattress or a horizontal mattress. See here, long, near. Here see, horizontal, one point here, A, B, C, D. It is like horizontal mattress. Following?
Yes, sir.
Yeah, this requires a lot of practical demonstration actually. If then only you will understand better. Okay, if you have seen it is okay. Otherwise, I have to show it. When I take a bite, I can show it. Okay, just to demonstrate on pictures, it is difficult. But in exam also, they may ask you this image only. So that's why I concentrate here. Vertical mattress. What is vertical mattress? What is horizontal mattress? What is simple interrupted? What is continuous? Only 4 sutures we have. Okay, interrupted suture or continuous suture. See here. See this last one. It is continuous. From here it starts. It is going here. It is a continuous subcuticular suture. Here it is interrupted, simple suture. Here he is having two 2 points in each. So it is a horizontal suture. Okay.
Okay, sir.
Yeah. Suture materials. Tell me about the suture materials you know.
Ethylon, vicryl,
Ethylene, vicryl, silk,
silk,
calicut,
catgut,
So basically natural and
synthetic.
Synthetic.
natural. There are again two types. Synthetic again two types. Natural, absorbable, non-absorbable. Synthetic, absorbable, non-absorbable. So first we'll discuss natural. What are the non-absorbable sutures in natural? You know, one which we use.
Silk,
Sorry.
silk,
Yeah, very good. Silk. Silk use here. Natural, non-absorbable. And surgical steel also. Surgical steel. Where we use surgical steel?
stapling,
Stapling. Okay. And one more also. To close the sternotomy wound. In cardiothoracic bypass surgery, they open the sternum, right? Then we use surgical steel to close the sternum, to close the bone. Okay. Silk and surgical steel. Whereas absorbable material, one material, can anybody tell me? Absorbable, natural absorbable.
catgut,
Plain catgut.
Very good. Catgut. So what is this catgut made up of? Intestine of cat? Yes, no?
Sheep's intestine.
Yeah, it is the intestine of sheep. Okay, it is a misnomer, but it is the intestine of sheep. Okay. So 2 points regarding that is it's a biodegradable thing. So have you ever sutured with catgut? Yes, no?
yes, sir.
Okay. So what is the peculiarity of this material, suture material?
Sir, easily it will be teared.
Yeah, it is teared. Strength will not be there. Much strength will not be there. So easily it will be teared. Okay. But before you suture it, you take pack. Did you observe the pack anytime? Yes, no?
Solution,
Yeah, very good. It will be in a solution. What is that solution? It is isopropyl alcohol. It will be degraded, right? Intestine will get degraded if you leave it like that. So it is stored in alcohol unless you use it. Okay. So the only suture material which comes in isopropyl alcohol container is catgut. So next time whenever you suture it, just before opening, see some solution will come out. That is nothing but it is isopropyl alcohol. Clear?
yes, sir.
Yeah, catgut made from sheep intestine. It is stored in isopropyl alcohol. These are 3 important MCQs. And half-life of catgut is 7 to 14 days only. So to increase the half-life, it is stained with chromic catgut, chromium salt. So it will increase up to 28 days, up to maximum 2 to 3 weeks. Okay, the half-life to increase it, it is up to 2 to 3 weeks with chromium. Otherwise, simple catgut is only for 7 days, 7 to 14 days. Clear?
Yes.
Okay. Then synthetic, non-absorbable. One material, synthetic, non-absorbable. Anyone? Starts with P. Yeah, ethylone also, but ethylone. Okay.
Polyester,
Proline. Yeah, polyester, proline. It is used for vascular. Whenever we close something, AV fistula, or if you do any vascular anastomosis, it should not degrade. Right? That the suture should remain forever. Almost at least 2 to 3 years. So proline is the suture. Proline you use for non-absorbable synthetic material. And absorbable synthetic, what is that? One suture at least. Absorbable
vicryl,
synthetic. Sorry?
vicryl,
Yes. Vicryl. It has a half-life of about 42 days. Okay. It is a degradable thing. It degrades around 42 weeks. So at least 6 weeks. So for that strength, for that time, it has that strength. Okay. So what is this device?
stapler,
Yeah, very good. It's a stapler. That is a stapler device. Okay. But what is that used for? To divide the bowel.
No.
Bowel division. Bowel division is done with this stapler. Okay. Earlier days we used to cut it, suture both the ends. It used to take a lot of time. Nowadays, just put a stapler, the bowl will get divided. Okay. In bowel division, we can use it. In anastomosis. This one, seen before, not seen? Seen, not seen?
Seen, sir. Circular stapler.
Yeah, it's a circular stapler. It is a linear stapler. It is a circular stapler. This is also used for bowel anastomosis. Okay. This end is there, na? This end is placed in the anus. Okay. In the anus. And then we can fire it. So that there will be a circular stapler. It is known as circular stapler for bowel anastomosis. Circular stapler. Circular stapler for 1 minute. Circular stapling device, it's called as circular stapling device for bowel anastomosis. Okay. So what is this?
It's a trocar.
Yeah, it's a trocar. It is known as Fosson's trocar. In which surgery it is used?
Laparoscopic surgeries.
Laparoscopic surgery. Okay, so this trocar, this one is left inside, this one, and this is removed outside, so that there will be a hole inside, so that you can insert your instrument through that. Okay, once you put a varus needle, give carbon dioxide inside, the abdomen will get distended. Take the needle out, put the trocar inside. The trocar will remain there. Then you put your laparoscopic instrument and you can operate. Okay, remember this is very important image. This is known as a Fosson's trocar used in laparoscopy. Yes, no? Come on, please.
Okay, sir.
Yes.
Yeah. What is this then?
Can you zoom it, please? Is it a single port trocar?
Very good. See, normally laparoscopy, how we do? Suppose this is the abdomen. We are doing a lap cholecystectomy. We are removing the gallbladder. The gallbladder is located here. Okay. So we put a port here. We put a port here. We put a port here. So with this, in this port, we put the camera. These two are operating ports. So how is the arrangement of the ports? Triangulation. This is triangulation. Okay. And your organ is quadrangle. See here. This should form a perfect quadrilateral. Then only you can operate. One, your vision is here. Your aim is there. You have two arms here. So this forms a perfect quadrilateral. Okay. That is the principle behind laparoscopy. Triangulation is the principle behind laparoscopy. You have both the arms so that you can use the arms to control the instruments. So there is your target. Whatever you want to do. There, if you want to do a gallbladder, if you want to do appendix, or whatever you do, you will see from here. There is an image port here, vision port, and you can operate. That is how we do it. Okay. But nowadays, so how many ports are there in laparoscopy?
Minimum of 3. One is at the umbilicus and depends upon where you're operating.
One is for vision, two is for your arm. Minimum of 3. Okay. Maximum you can put another port to retract or something like that. But minimum of 3 is a must. But nowadays we are going into minimal to minimal invasive surgery. So see this port. So this port may be given to you. This port is a single incision laparoscopic surgery. See here, all the 3 ports are there in only one trocar. So here for vision, for your instruments. So this is known as single incision laparoscopic surgery, SILS. Single incision laparoscopic surgery. Okay. Clear?
Yes, sir.
It is also known as less laparoendoscopic single incision surgery. Less SILS is equal to, both are same. Laparoendoscopic single port surgery. Okay. What is notes?
Natural orifice.
transluminal
Transluminal
endoscopy.
endoscopic surgery.
Surgery.
Okay.